We got a low reading on the fat metabolism point, and now I would like to demonstrate a remedy test. Biophysicists say everything oscillates in the universe and has a energetic information and frequency. By knowing this, I recommend your remedies or whatever you test to keep a little bit away from the area you test, not have everything surrounding your test plate. So I'll just pick a remedy which I know which works on fat metabolism, and I won't tell my patient, so we may not influence them. I'll just grab something. And I'll retest, and you remember we had a 40. Good. It got a little higher, so maybe he responded good to this. Now, for demonstration reasons, I will repeat this whole procedure. I just cleared the information by touching, making a short circuit, and start over again. I want to get a baseline. Yeah. Did I use the same pressure right now? Good. You see how sluggish this comes? How it came up? Now I picked a particular remedy which I already know it works. It's on increasing fat metabolism. So I will retest it. And do I give the same pressure? And it instantly responds faster. Good enough for me. I do not look now acribic to see, is it 50, 51 or 2? Don't go there. I felt a response. You could almost say it was an electronic kinesiology test. He changed, something changed. It felt different. He responded faster. That's your signal. That's what you look for. Don't get glued to, oh, I got it to 48 and things. It will distract you. We need to learn to feel this. The feeling, I know, it's subjective, and that may cause some questions and raises some flags in the traditional medicine, but trust your feeling. Trust your machine. And what I found here was artichoke extract. Artichoke extract will increase bile flow. It will help to digest fats. It's a fact. And the artichoke extract was discovered in the 50s, and it's actually an old folk remedies, and they found an active ingredients in that called cynarin, and believe it or not, that was some of these findings and chemicals they found were the base for development of lipid blockers. And we know the side effects lipid blockers can have. So artichoke, a wonderful natural remedy. In this demonstration, I will shortcut this test right now by just demonstrating some points. But please, when you do the test, follow your protocol. Test every point. I will advance to the next point. And here we have a kidney point. And it's located in the middle of the calcaneus. So to easier find it, you could just envision a circle here and go right in the middle, the target. And remember, the skin is flexible, so you can wiggle around and dig yourself in there. This is a very good summation point of the whole kidneys. Although it says here, kidney point 3, the renal cortex. I almost would like to refer to it as a control measurement point. I've never been disappointed. It's very accurate. So let's test this point. A little low. Let's go again. It's a good reading. Now let me repeat it again. Okay. I'm happy with that. You will find Low readings, for example, when somebody's kidney functions are very compromised. I saw it quite often in people on dialysis. You find high readings when they maybe have bladder infections, kidney infections, or just irritations, or don't drink enough water, etc. And then you do your remedy test. This is an excellent point also to determine heavy metal stress. Traditionally, in Volt testing, the kidney points are mainly tested on the little toe. This is a very small area, and many points are located there, and are found particularly in women who wear tight shoes, that the skin is very red, very sensitive, often very moist, and I get not quite accurate readings, and particularly also during medication testing, remedy testing. So over the years, this point established itself as a very reliable kidney point. And you have a large area you can't miss. Another thing you want to know about EAV is that sometimes a patient will say, oh, this point hurts. And that is also an indication there might be some problems with this organ system. And particularly when the kidney points do pressure, you can just use your thumb, and if they feel pain, they may have some problems with their kidneys. In reflexology, we find this quite often. People who know about reflexology, they are aware of this. So if a point hurts, take that as an information. And when you do a successful remedy test, and you go back to this point who was hurting before, the patient says, oh, or you ask him, it doesn't hurt so much anymore, because your remedy already sent a signal to the nervous system, and they feel less sensation at this point, which is quite remarkable. Now I would like to advance to the liver meridian. The liver is such an important organ, and we see so much liver stress. Without that as this established clinical diagnosis, without that you have elevated liver enzymes, etc. But many people suffer from a sluggish liver, which is kind of a term we like to use. They not have a disease yet there, but they already have diminished functions of the liver, and it's such an important organ, and we can do so many goods with very mild therapies and liver cleansers. The first point is located again like at the hand, and it's actually the opposite of the pancreas point I tested before. It's liver point 1. And it represents the venous function of the liver, which means the detoxing capability of the liver. If you see an abnormal reading at this liver point 1, it indicates many times a sluggish liver. They need some liver detox. You can do major improvement by just using some herbal or homeopathic remedies, some drainage remedies. I prefer the drainage remedies, particularly at the beginning of a therapy, to open the channels. What is a drainage remedy? A drainage remedy is a remedy where the active ingredients increase metabolic functions. They increase circulation in a particular organ. Therefore, the metabolism of the organ speeds up. Like what we had before, an artichoke remedy would be a drainage remedy. It will make the liver work harder, flushes out a lot of these toxins and deposits. The next point is liver point 2, and that reflects the cellular system of the liver. So it's a deeper I dig deeper into this organ system. Venous function first, sluggish liver.